good morning, or whenever you're tuning in for your daily psychiatry boost. I'm so glad you're here, carving out this time for yourself to grow and deepen your understanding. Whether you're just starting out or refreshing what you know, every session like this builds your confidence and sharpens your insights. Today, let's dive in with a positive mindset. You've got this, and by the end, you'll feel even more empowered. Remember, learning is a journey, and you're taking meaningful steps forward right now. All right, let's focus on today's topic. Anxiety disorders. These are among the most common mental health challenges people face, affecting daily life in profound ways. Anxiety disorders go beyond everyday worries. They involve excessive, persistent fear or anxiety that interferes with functioning. We'll explore 3 key points to solidify your grasp on this area. First key point, the major types of anxiety disorders and how to distinguish them. The DSM-5 outlines several, but let's highlight a few core ones. Generalized anxiety disorder, or GAD, features chronic, uncontrollable worry about various aspects of life, like work, health, or finances, lasting at least 6 months. Then there's panic disorder, marked by recurrent, unexpected panic attacks, sudden surges of intense fear with physical symptoms like heart palpitations, sweating, or shortness of breath, often leading to fear of future attacks. Social anxiety disorder involves intense fear of social situations where one might be scrutinized, such as public speaking or even casual conversations, leading to avoidance. And specific phobias are irrational, intense fears of particular objects or situations, like heights or spiders, triggering immediate anxiety. A helpful mnemonic for remembering these is GPS, generalized panic, social, plus phobias as the outliers. Clinically, distinguishing them matters because GAD might show as restlessness and fatigue, while panic could mimic a heart attack, requiring careful differential diagnosis to rule out medical causes. Second key point, the role of cognitive distortions in anxiety disorders and how they perpetuate the cycle. Cognitive distortions are faulty thinking patterns that amplify anxiety. For instance, in GAD, someone might engage in catastrophizing, imagining the worst possible outcome from a minor issue, like assuming a headache means a brain tumor. All-or-nothing thinking is common in social anxiety, where a small social slip-up is seen as total failure, reinforcing avoidance. Overgeneralization happens when one negative experience, say a panic attack in a store, leads to believing all public places are dangerous. These distortions fuel a vicious cycle. Anxiety leads to avoidance, which temporarily reduces fear but strengthens the disorder long-term. Clinically, recognizing these helps in therapy. For example, in cognitive behavioral therapy, patients learn to challenge distortions with evidence-based reframing. A quick example, a patient with agoraphobia might avoid crowds due to overgeneralization from one bad experience, but gradual exposure can break that pattern, improving quality of life. Third key point, evidence-based treatments for anxiety disorders, blending psychopharmacology and psychotherapy. Starting with medications, selective serotonin reuptake inhibitors, or SSR, is like sertraline or escitalopram, are first line for many, as they help regulate serotonin levels to reduce anxiety over weeks. Benzodiazepines, such as lorazepam, offer quick relief for acute symptoms, but are used short-term due to dependency risks. For psychotherapy, cognitive behavioral therapy, or CBT, is gold standard. It teaches skills to identify and modify anxious thoughts and behaviors, often with exposure techniques for phobias or panic. Mindfulness-based approaches, like mindfulness-based stress reduction, encourage present moment awareness to interrupt rumination. In clinical practice, combining modalities works best. For a patient with severe OCD, an anxiety-related disorder, CBT with exposure and response prevention, plus an SSRI can lead to significant remission. Remember the mnemonic CBS for core treatments, CBT, benzodiazepines, sparingly, and SSR is. Tailoring to the individual, considering comorbidities like depression, ensures better outcomes. Whew, that was a solid dive into anxiety disorders. Take a moment to reflect. Which of those key points resonated most with you? Maybe jot down one thing you'll remember, like the GPS mnemonic for types, or challenge a cognitive distortion in your own thinking today. You've just invested in your knowledge, and that's something to celebrate. It accumulates, making you stronger and more insightful with each session. Feel that confidence building? You're doing great, and I can't wait for our next time together. Keep shining, and until then, carry this energy forward.